Now, many people will be coming to the end of a dry January and kick-started by excessive consumption over a probably somewhat muted festive period. 2020 will have made the need for a month without booze more important than ever. Many studies, including the Global Drug Survey Special Edition on COVID-19, has shown that 30 to 50% of drinkers reported drinking more during the lockdown, and for many with negative effects on their physical and mental health. Excessive alcohol also suppresses your immune system and makes you more vulnerable to respiratory infections. Dr. Emma Davies is one of the founders of Global Drug Survey, and she joins us now from Oxford in the UK via Zoom. Dr. Davies, thanks very much indeed for joining us. Welcome to the programme. Tell us about this charting about people's drinking habits. Why would you want to do that?
Thank you very much for having me, and good evening. So I'm part of the Global Drug Survey, and we're really interested in what we can do to make drug use safer, regardless of the legal status of the drug. And as you know, alcohol is one of the most commonly used legal drugs around the world. And what we'd like to do is to help people to make more kind of healthy and sensible choices around drinking. So that's one of the reasons why we collect our survey data every year, to find out about patterns in people's drinking and find out a little bit about certain things that we can do to maybe encourage people to drink a little bit less. As you mentioned, many people have drank a little bit more when they've been in lockdown situations.
All right, let's assess what period did you measure? What were you looking at?
So last year in the Global Drug Survey, so before the pandemic, if we can imagine such a time now, we were interested in finding out about different things that might mean that people regret getting drunk. Because if we can find out things about why people regret getting drunk, then perhaps we can get them to think about those things, and maybe that would encourage them to actually drink a bit less overall. So we know that lots of people drink not with the idea of thinking about their health, but just they're thinking about the short-term effects. They want to relax, they want to have fun, they want to socialise, wind down from a busy day. People don't generally want to have a bad time when they're drinking, but unfortunately our research shows that lots of the time people do actually regret getting drunk. So we asked people how many times they've been drunk in the last year, and then how many times they regretted getting drunk. So we asked people all around the world, and on average, people said they got drunk about 20 times a year. So that's, maybe 1 or 2 times a month. And people regretted it about 25 to 30% of the time. So if you think about it, that's actually quite a big amount of time that people may be encouraged not to get drunk, and that would do themselves a little bit less harm in the long term, and of course in the short term as well, because of some of the things they told us that they actually regretted. We were interested as well to find out, okay, so you regretted getting drunk about 25 to 30% of the time. Why was that? What were the reasons that people got so drunk that they regretted it? And I'm going to tell you the top 3 reasons, and you probably won't find them that surprising. So first of all, people said that they drank too quickly. So they kind of were in a hurry. So good advice there would be to slow down when you're drinking. Secondly, people said they've been mixing their drinks. So we know that people might make poor judgments and not be aware of the strength of different things when they're mixing them together. And the third reason was that they were hanging out with other people who were big drinkers. And sometimes in certain cultures, it's common to get into a habit of buying rounds. So if you're in a round with 5 or 6 other people and they're drinking really quickly, then you might be drinking to keep up, or because it seemed to be your turn to buy the drinks. So that's really interesting and gives us an idea of how we can help people to think about drinking a bit less. We also found out what happened then, what happened to make you regret getting drunk. And of course, people ended up reporting that a hangover was the most important thing, the most common thing that happened. But also people said they might have said something they regret to somebody, so loosening those inhibitions and maybe mentioning something you didn't wish you had, or telling a secret or something. And thirdly, one of the really interesting reasons was that people reported greater anxiety the next day. This is actually really interesting and something that we're hoping to look into a bit more in this year's Global Drug Survey, which is running at the moment. But this idea of anxiety the day after drinking, or hangxiety as some people call it, where you feel really awful the next day and you feel really rubbish, it has a biological basis, as well as the fact that you might be thinking back to some of those things you've said as well. So what we're hoping to do with this information is think about ways to encourage people to drink a bit less and have a few less regrets, really.
All right, so what you assessed was before COVID, is that correct? So what are you expecting this year? Because, you know, people are stuck at home, and so things will be slightly different, won't they?
Things are really different. So yes, the results that we've released today are from the study that we did before COVID. And then we also ran a study during COVID to look at people's drinking habits in lockdown. And that's the figure that you mentioned at the beginning, where we found, depending on the country, maybe 30 to 50% of people are drinking more. So in this year's Global Drug Survey, which, as I mentioned, is running now, we're interested in exploring a little bit more about regret. So interestingly, we know that some groups of the population anyway, are drinking more in lockdown, and that might be associated with different types of regrets, because of course we're not going out into those social situations, we're not going to bars and clubs in most places in the world at the moment. So what is it that people are regretting now? Is it that it heightens your anxiety relating to the pandemic? Is it that you still said something you regret, all of those drinking parties and quizzes that people are doing on Zoom? Or is it that it's other reasons and similar reasons? And if we can find out about the reasons why people might be regretting drinking a bit too much now in sort of lockdown situations, that's really going to help us when similar things happen in the future. And overall, it gives us a picture about how we respond to different world events and how our drinking behaviours respond. So we're really hoping to find out lots of information from all sorts of groups of people around the world and have a look and see if we can help people to drink a bit more healthier in lockdown, and hopefully beyond as we emerge from lockdown, and maybe reevaluate our relationship with alcohol a little bit.
There's a few countries in the world that have got a poor reputation: Russia, Australia. Which countries seem to be drinking with regret the most?
Well, I'm speaking to you from the UK, and unfortunately it seems that there's quite a high level of reported drunkenness in the UK and Australia as well. But actually, in terms of the people who regret it the most, then it's completely a different story.
Yeah.
So it seems like in the UK and in Scotland and England, for example, and Australia, it seems to be quite a high proportion of people having reported getting drunk a bit more. And in countries such as Colombia, Argentina, and Portugal, they don't seem to report getting drunk quite as much, which is interesting. Now, in terms of the actual countries of where people are talking about regret, there's some interesting patterns there as well. So the countries that reported getting drunk the least also seem to regret it the most. So perhaps there's something there in the different cultural expectations and norms and patterns of drinking that means that actually it's really socially unacceptable to become so drunk that you're out of control. On the other hand, we find that particularly Australia, Denmark, places like that, United States, tend to be people regretting it a little bit less. So perhaps that's another sign that, you know, we're not very good at especially in the UK, giving sanctions to people for getting drunk. It's almost part of the culture, at least, you know, when people are out and about, when they can be out of lockdown. So we do see some really fascinating country differences, and some of them do live up to the cultural stereotypes, I'm afraid.
I wonder if Liverpool fans are not drinking last night to regret what happened. But these are interesting and fascinating statistics that you pulled together. And I just wonder, over the years, having seen what causes the regret, have you been able to affect change?
Well, we've done a few small studies just in the UK looking at the potential of highlighting this idea of what we call anticipated regret as a means of getting people to think about reducing their drinking. So the idea there is, if we can get you to think a little bit about what might happen if you drink too much, what you might say to somebody, then maybe you might be able to think that, oh, actually, maybe I won't have that extra pint because that regrettable experience could happen to me. And we've done some small studies that suggest for some groups of people that would be something that's quite effective. Certainly, again, there are country differences there. So we noted a couple of years ago, for example, that respondents from Germany were more likely to worry about things like social embarrassment and humiliation. So that sort of level of regret was important for people from that sort of area. So yeah, we're hoping that we can develop some more tools and some more interventions to help people to drink a little bit less by focusing on these short-term regrets.
Yeah.
Because for a lot of people, the kind of health effects of drinking seem a long way in the future. They're not things that are going to happen to us immediately, but you could certainly feel regret the next morning. So it does have a useful purpose for encouraging us to drink a bit less.
All right, we've run out of time, but very quickly, if you can answer this, how do you measure what drunk is?
Well, that's a good question, and the short answer is we've asked people in a kind of very detailed way this year about drunk, because the previous year we said, just how often do you get drunk? And when we translate our survey into lots of different languages, we weren't sure if that works. So we talk about losing your physical and mental faculties, being off balance, your speech affected, not being able to focus on things, and your behaviours being different. So we hope that that covers a lot of the experience of drunkenness.
Dr. Emma Davies, thank you so much indeed for sharing the results of this fascinating study. And we look forward to seeing this next one during the COVID period. Thanks so much for your time.
You're very welcome. Good evening.
Bye-bye. Right, so there you have it. Interesting statistics, isn't it? A number of people who get drunk but actually regret it, and that's what's interesting. And hopefully, if you're aware of the things that make you feel regret, that might change your behaviour.